When a person is exposed to a poison or an overdose of medication, it is important to identify and treat immediate life threats, such as difficulty breathing. While knowing what substance is causing the patient's illness is important, your primary job as an EMT is to treat the life-threatening symptoms. Poison types. A poison is any substance that causes damage to the body. While some poisons may simply make an individual ill, others can be deadly if emergency care is not delivered. While most poisons are thought of as chemicals or substances, biological poisons exist in the form of toxins, such as with certain snakes. A poison can be introduced into the body in 4 ways. Ingestion. Many common items around the household, such as cleaners, medication, insecticides, petroleum products, and pool chemicals, can be poisonous if ingested. When assessing poison patients, try to determine when, what, and how much was ingested. Question what kind of symptoms they are having. The treatment for the ingestion of poison depends on the type of poison ingested. One common form of treatment is the use of activated charcoal. In this process, the patient is administered the charcoal, which will cause the poison to bind to the charcoal, preventing any further absorption into the body. Finally, an antidote may be administered when applicable. Inhalation. Inhalation is another route in which a poison can enter the body. Carbon monoxide, insecticide spray, chlorine, or vapors from chemicals can all be dangerous or deadly. Symptoms include headache, dizziness, dyspnea, nausea, cyanosis, and coughing. Once again, ask when, what, and how much the patient was exposed to. Remove the patient from the environment if safe to do so. Open the patient's airway. Administer oxygen. Contact medical direction. And transport immediately. Before transport, you may be required to remove the patient's clothing and rinse the patient to eliminate any fumes that may still be emitted. Absorption. These poisons are taken in through skin tissue and introduced into the bloodstream. Determine what chemical or substance the patient was exposed to, how long they were exposed, and what symptoms they are experiencing. Remove the remaining substance from the skin or clothing as necessary. For dry powders, brush the powder off the patient. For liquids, copious amounts of water should be used to rinse the substance off. Irrigate for approximately 20 minutes. If the exposure is in the eye, irrigate with water, being careful not to flush the runoff into the unaffected eye. Transport the patient, bringing with you any information on the poison, such as bottles, MSDS sheets, or labels. Injection. Injection includes snake bites and illicit IV drugs. The poison or toxins that enter the bloodstream through penetration of the skin can produce acute effects. Substance abuse. Drugs or alcohol can act as a poison and cause damaging and permanent effects on the body. Patients under the influence can be dangerous to the EMS worker, as they tend to be violent and have lower inhibitions. Extreme caution should be used when treating a patient on illicit drugs or one who has consumed too much alcohol. Alcohol abuse. While most people can tolerate moderate consumption of alcohol, others who consume too much or who are on medications that increase the effects of alcohol can develop concerning symptoms. A patient who takes medications such as tranquilizers, antihistamines, or antidepressants with alcohol can have a deadly outcome. Also be aware that chronic drinkers may have metabolic issues, such as the inability to regulate their blood sugar. Assessment of these patients may be difficult. When treating these patients, look for slurred speech.
I'm just trying to find my cards, Saul.
Smell of alcohol on their breath, nausea, vomiting, confusion, slowed reaction time, and the inability to concentrate. Some patients who have an alcohol dependency show signs of delirium tremens, or DTs, if they have recently abstained from alcohol consumption. This may cause signs of hallucinations, sweating, hypertension, tachycardia, and unusual behavior. This condition can be lethal, and immediate medical attention is necessary. Treatment of alcoholic conditions begins with scene safety and a primary survey. Be alert for breathing problems which may indicate airway obstruction. Have suction available in the event the patient vomits. Look for trauma that may have occurred that the patient may not be aware of. Monitor the patient's vital signs and transport. Illicit drug use. This activity consists of utilizing drugs or any chemical substance for non-medical use. The 5 common classes for these substances include the following. Uppers are drugs that stimulate the central nervous system. Symptoms include excitement, tachycardia, dry mouth, dilated pupils, sweating, and restlessness. Downers. These compounds suppress the central nervous system, typically causing lack of coordination, sluggishness, and slowed respiratory and heart rates. Narcotics. These medications are usually used to treat pain. They can create a sleepy or a dazed feeling and can be highly addictive. Narcotics lower heart and respiratory rates. Patients intoxicated with narcotics will often sweat profusely and have pinpoint pupils. These patients may deteriorate quickly, leading to respiratory arrest or cardiac arrest. Hallucinogens. These chemicals alter the user's perception and create intense excitement by altering the central nervous system. Common hallucinogens include LSD and PCP and are popular at rave parties. Hallucinogens can cause rapid heart rates and dilated pupils. Users may claim they see or hear things that are not actually present. Volatile chemicals. These chemicals are usually over-the-counter products that produce vapors that can be inhaled. This produces a feeling of euphoria. These chemicals can cause an altered mentation or coma. A patient may describe numbness or tingling in the head or body. The drug can cause lethal heart rhythms, resulting in death. Treatment. When providing pre-hospital care to a patient under the influence of a drug, first ensure your safety. A police officer should be present in case the patient becomes violent. Try to keep the patient calm and gain their trust. Next, perform a primary survey and pay special attention to the patient's airway. maintain patency, and provide oxygen. Use of a BVM may be required if the patient develops bradypnea or slow breathing or respiratory arrest. Monitor vital signs and gather a baseline set of vitals, including pulse, respirations, blood pressure, and oxygen saturation. Perform a physical exam and look for any injuries the patient may have incurred. Also, look for signs of IV drug use, such as track marks along the patient's veins. Transport the patient to the closest appropriate medical facility.